My name is Dr. Shikha Jain. I am an oncologist in Chicago at the Rush University Medical Center, and I subspecialize in GI malignancies. Cancer care has been drastically altered by COVID-19. We are seeing oncologists across the country use televisits, use phone calls, and delay clinic visits in patients who normally we would be seeing every couple of months. It's been a big challenge for patients and physicians alike. And unfortunately, it seems that COVID-19 is going to continue to be an urgent issue. So, for the next couple of months in the foreseeable future, cancer care is going to change. I think it's really important that we remember the human connection is essential in oncology, and we need to make sure that we are doing the best we can to comfort our patients, reassure them, and guide them as much as we can. I know it's challenging to do that over video visits and phone calls, but even the sound of our voices can sometimes make our patients feel better and put them at ease. Now, the challenge with cancer care is we are learning so much about COVID-19 on a daily basis, and we are very fortunate that organizations such as ASCO and the American Cancer Society are providing us with as much accurate and up-to-date information as possible. But it's really important to continue to guide our patients with the most up-to-date evidence-based information, while also explaining to them that the information that we're giving may change as our understanding of COVID-19 changes. Cancer care is going to be modified and changed for the foreseeable future, and I think it's up to us to learn how to adapt to continue to provide the best care we can for our patients while continuing to provide evidence-based care to our best abilities. So we are very fortunate in our institution that we had an excellent plan in place for patient care and to transition patients during a situation such as this. We have implemented telemedicine visits, video visits. We have decreased the number of visits needed for surveillance and for imaging. We have recommended, according to the ACS and ASCO guidelines, that patients coming in for preventative care delay for the immediate future. And our patients have been very appreciative of the fact that we've been able to transition in a very challenging time by still providing care, but doing it in a virtual setting primarily. Now, patients who need to be seen inpatient are still seen by physicians and nurse practitioners in the clinics, and patients who need to be admitted are still admitted and given excellent care. But we try to minimize the number of patients who are admitted and the number of patients who are seen in the clinic to prevent the spread of COVID-19. Right now, COVID-19 is causing worry and anxiety for everyone, patients, caregivers, physicians, nurses, respiratory therapists. I think that a lot of people are scared not only because this disease is a scary disease, but also because there's so much that's not known. Currently, there's shelter in place orders in most of the country. People are social distancing, and we're showing signs of flattening the curve. But all of these things also lead to an increased sense of isolation, anxiety, stress, fear. And it's not just our patients who are feeling it, it's also all of us. My advice to patients is to try to find support groups online, virtually. Try to connect with family and friends as much as possible over the phone, virtually, through FaceTime, through the computer, through Zoom. I've seen a lot of my friends and family and colleagues and patients start doing things where they're reconnecting with people they haven't spoken to in years. And so I'm trying to reintroduce the human connection and remind people that we are all going through this together. And so connection is extremely important in these types of times. I've seen a lot of people who've taken up meditation and who have started seeing virtual therapists. There's a lot of apps that are out there now that offer mindfulness and meditation and self-care. I also encourage people to exercise if they are able to, whether it's going out for a walk and maintaining social distancing while wearing a mask, or whether it's exercising in your own home with a workout video, or getting some friends together on a Zoom call and doing a dance together. There's a lot of ways to try to keep up spirits, but the human connection cannot be underappreciated. You really, really need to advise your patients that isolating and being alone during this time can only amplify the anxiety. And so it's really important to try to have those connections and to find your support systems, whether that's friends, family, online support groups, your healthcare team. There's a lot of people out there who are able to provide support. And it's really important that patients and physicians and all in the country really reach out to those support systems. One thing that I've seen come out of this crisis and this global pandemic is I have seen phenomenal work from people across the country coming together to share information. Social media has been key in spreading information internationally. There are Facebook groups that have popped up that are covering COVID-19 and getting advice from people in Italy, from China, getting real-time advice on how to manage patients. Organizations such as ASCO and the American Cancer Society, the CDC and the WHO have been phenomenal at keeping information up to date and getting that information out to people. I've seen people on Twitter sharing information and anecdotally getting advice for their patients. So I think that there's been some extraordinary work that's happened across the country. Here in Illinois, myself and 5 other physician colleagues started a group called Impact, which has been working with our local and national leaders to advise on policy as well as on different rules and regulations that are going into place in Illinois and nationally, and using evidence and science to help guide our nation's leaders in order to actually implement things that will work to control this pandemic. So I think the most important thing is continuing open lines of communication, making sure that people are utilizing every avenue that's available. Social media is an incredible tool, and it has shown in the last month how impactful and effective it can be by mobilizing large numbers of people from around the world to work towards a similar goal of controlling this global pandemic and helping people get back to their lives. To our cancer patients, just know that your team, your physicians, your social workers, your nurses, your MAs, we are all here for you. And it's our job and our goal to help you navigate this very, very challenging situation. We have drastically changed the way we take care of our cancer patients, but we still care very deeply to make sure that we provide you with the best, most evidence-based and up-to-date care, information, and guidance. So I strongly encourage all cancer patients out there to please, please keep the lines of communication with your healthcare team open. Talk to them, share your fears, share your anxieties, have discussions, and utilize your team to help you make decisions that are challenging to make. To caregivers of patients out there, it's incredibly important that you also utilize the healthcare team. This is a challenging time for everyone. And in order for us all to provide the best care we can to patients across the country, it's really important that we are open and communicate, and we share our fears, and we use science and evidence to make the decisions that we make.